What can be done to overcome denial of symptom onset?
Okay, so the question in terms of denial, is that the quote unquote patient's denial? Is that caregiver? Is that family? So when we talk about denial, there's this funny term, Latin term called anesthesia. And it's really just a Latin term that means lack of knowing. So the question is, why do we need to say to somebody, you have Huntington's disease, you have to confess up that you have Huntington's disease. So I want you to kind of go back, whoever asked the question, and think about that. Can we go around this and just say, okay, there's some symptom here, we don't know what it is, and can we just treat it? We have to label everything as Huntington's disease, as a psychiatric illness. So it's a question for me when I have people come into my clinic, or families that say to me, my loved one doesn't think that there's anything wrong. Then we start having these open conversations in terms of what are the symptoms, what's going on, can people in the family be honest in terms of, when we walk into the room and we're all on eggshells because we don't know what mood this person's going to have. Well, that's an issue. Can we label it as that and say, well, it's really something's uncomfortable in the home. So my feeling is it's not a question of just saying the person has to say, I have Huntington's disease, but can we treat symptoms and have an open communication in the family?
I completely agree with what you said. I would also point out that sometimes the denial or anesthesia is because of what's happening in the brain because of Huntington's. And so it's not, and probably almost never is a willful denial of the state, right? Or the symptoms or having HD or being part of the HD family. And so we need to also extend a lot of grace to people who are dealing with HD and yes, treat the symptoms, alleviate the distress, right? And it doesn't really matter again what we call it, as long as what we're doing is addressing the needs of the patient.
And hello, I think that one of the challenges that family members face is when the member of the family with Huntington's or with a Huntington's diagnosis is not accepting of help or not accepting of assistance. And I think it's important to keep that communication open very early on, saying, we're both on the same team, and I'm not going to lie to you. I'm not going to tell you things that aren't correct. But what I'm trying to do is help you navigate this condition and try to get some cooperation from the get-go, so that the person with HD will trust their family member and be accepting of help.
One of the other things about HD is it's sometimes hard for family members to understand how someone can be in denial. It seems to them symptoms are so obvious. I'm just going to tell a little story about a patient with mine. And all symptoms don't necessarily have to be treated, but he was very active in our HD local community for fundraising because he knew HD was in his family. And he was a CEO and still working for a construction company. And he was at his daughter's wedding and he saw a video of the wedding guests. And he was going, oh, look, there's cousin Fred, he's pretending he's dancing to the music, and there's Aunt Martha over there. And then it zooms in on this guy in the back corner, and it's him. And he sees himself moving for the first time, although family members have been hinting he had symptoms. So he came to clinic, he got tested, and because he was so good at communicating, aside from the career, he was doing quite well. I invited him to a medical school class of mine for first-year medical students just to talk about how he felt about HD and having the possibility of his children now performing the gene and things like that. And at the end of these sessions, when I do patient student sessions, I always ask the individual who volunteered to come and talk, how did it go? Did anything bother you? They asked him, and he said, the only thing that bothered me was at the beginning of the session, you asked them if they could see my movements. And the whole class, it was about 60 students, shook their head and said yes. And he said, how could they tell? And I'm going, you could see you. Am I correct? He said, they're first year medical students. You told us that they didn't know anything about HD yet. And just that concept of he himself had seen HD, but still was having trouble. He just couldn't see how it would see. So the understanding how the brain's working makes that diagnosis. And the limitations, not just movement, drive, and the mind to stop. Not easy to see.
So this is a question that a lot of people, do I sound louder than the panel? So this is a good one? Okay, so volume like here would be great. Oh no, they want the panel. Yeah, the panel they can't hear as well. So with online shopping, it is easy and convenient, which makes it even more challenging for my HD person to manage their money. What are some strategies to keep the spending in check?
This does come up, and I think that this is also kind of goes into that anesthesia and lack of awareness in terms of judgment, not just movements, but also judgment. And what I tell families, I'm getting a little bit of feedback. I don't know if you guys can hear it. It's a little echoey. So just, no, is it okay? Okay. So what I tell family is sometimes we do need to go in and put a kibosh on this and stop all of this. And that's getting a power of attorney if it's a family member that you're not directly related to, such as a spouse who might be able to go to the bank and say, I'm cutting off all credit cards. This is something that I do tell people to do, to talk to an elder care attorney in terms of their finances, to make sure that somebody's not going through their spending. And it's hard to do that because this is not the future that you wanted. You wanted to be able to maybe save up or do things together. But this is also a reality because if this does continue, and I have had patients in this situation, they're going through thousands, sometimes tens of thousands, sometimes hundreds of thousands of dollars. So I really do suggest, cutting off the credit cards, getting a hold of these, cutting them off, and talking to the bank in terms of making sure that person does not have access to these. And I know it's going to upset that person. But is it going to be worth it to upset that person for a short period of time, or to say, here's an allowance, here's a card that you're allowed to have, and it's $25, whatever you can feel like you can afford, versus going through your whole savings and going into bankruptcy or to debt and losing all this money. So it's a bit of a risk kind of thing.
One other thing to add is if the person with HD is receiving Social Security disability, then becoming a direct payee for that person in order to limit the spending again. And also we see people who become victims of scams as well fairly frequently, again, because of that loss of judgment. And so it can be more than just, online shopping. It can be really quite distressing because then not only are you dealing with the financial issue, but also that issue of judgment, and that people will feel, shame at having been victims of a scam as well. And so we want to try to.
I have a personal story to share about this one. Unfortunately, my husband was the person in my family with Huntington's disease, and he has since passed. But he was, prior to his symptom onset, he was an accountant and a CPA, and just worked with numbers all the time. And once he wasn't able to work anymore, he wasn't able to find positions or get hired for positions. He had a lot of time on his hands, and he decided that he could do some day trading from home. And he was on that laptop all day long, trying to first going through a training program, trying to go through the day trading. He would come up to me so excited and say, "I made $10,000 today," and I said, "That's good," because it was on the simulator. And then when it came time for him to go live on the day trading, he was just losing and losing and losing. And looking back on that, I don't know if that was a scam, if it was set up so that the simulator would always make you win, and then when you go live, you lose. But it ended up emptying our bank accounts and became quite problematic. And as a caregiver, you don't want to take away something that the person loves. and something that keeps them busy and keeps them interested, keeps their mind going, but you also don't want your checking account to get drained every month. So I worked with the company that provided that simulation software and made the call to them, explained what Huntington's disease was, and I said, can you put him back on the simulator? And after that point, he went back on the simulator. He got to use his brain and use his talent with numbers and enjoy doing that. But our bank accounts weren't in danger anymore. So that was something that worked for us. And another thing that I think about is like the little video games that on your phone that you have to think about, but every 30 seconds an ad pops up or something pops up to spend some money. You got to be really careful about those because although they are good games to play and it keeps your brain occupied, they can end up costing a lot of money. So we want to be careful about that. I'd love to find a video game or a phone game company that would make a version that doesn't pop up with, oh, buy 50 more coins and let's see how it goes.
I'm sorry, I hope you got some of your money back.
We never got the money back.
And so that is the family of big, it's a lot of money, that sort of thing. I did have a patient who started day trading, but they didn't, fortunately, it was related to his job before, and he actually, I don't think he did a simulator with day trading. He didn't lose a lot of money, but he was spending hours and hours, on the computer, and then eventually it was having to give up. So I think one of the other things, again, based on something that happens when you just leave last week, is it turned out to be good in the sense of a family. There was a family with a woman with relatively young onset age, 30s when we first saw her. But early on, the family got together with the lawyer and delegated a POA. And so just recently, her mother sent me a letter because she's now in a nursing facility. Somehow there she can still access her bank account. But in the power of attorney letter, which was very old, there was a very clear section on the bottom that says, I agree that once my doctor sends a letter saying that I'm no longer capable of managing my funds. And she was clearly at that point. So I was able, because it was already planned years ago, who the person was. And so discussing this even with family members, with other health systems, we should plan and see if we can come up with who's going to be responsible and work with the lawyer or not. I must confess that my husband and I have 2 children, and we should have done this earlier, but we didn't do our wills with who was going to be designated for the children until they were 18 years old, at which point they would have been considered adults. We're planning ahead with that early on in the disease, contacting the lawyer to get that.
Thank you. And then also, if you guys have things to chime in, a lot of us have found stuff. So if you guys have found something, please let us know because we want to help. One thing in our support group that's come up is there's these great green cards now, right? Where it's limited money. And so if like maybe that's something like that, if someone forgets that they have, a balance, you just put it on this green card, they still have their independence, they can still shop, they can still do their stuff, but then it stops you at the right time. So I don't know if you're going to do this yet.
With your local credit unions, you can actually set funds into a separate account. And you can adjust that just right through your phone app. And you can add funds to that, and it could be just a separate account.
Yeah, that's smart. So like go to your bank and do that with your
Yeah.
local credit union.
And it's free at the credit unions.
Yeah.
You can actually earn reward with it at the credit union. So.
So this one is talked about a lot. Will being put under anesthesia bring on your symptoms more aggressively? Doctor.
They're all saying it's me. This is definitely, it's a question of concern. I'll often get a question from a doctor, this person who needs to have their appendix out, do I need to do anything different with the anesthesia? And their answer is pretty much no, just do what's best for the procedure and the process. The literature on this is not really clear, and I think it's complicated because it may come a little bit on the stage of disease and age of the patient and other factors. Even a small procedure under anesthesia for a period of time, you can measure in the cerebral spinal fluid whether the person has HD or not. A protein called neurofilament light chain that's associated with disease progression. So there's some thought that there's some trauma to the brain to some degree, or not necessarily trauma, but change in function. And then the question is, does it cause deficits? And there's some diseases where it looks like it may affect things, but in general, I don't think the effects are very significant long-term, but it's not something I can guess I'm an expert on. If you need surgery, it's vice versa. There's no reason not to do that. In the current gene therapy trials that are being done here and in Europe, the individuals are under anesthesia for a prolonged period of time. And in those cases, there's not been any demonstration or noting a significant problem with the patients who've been under anesthesia with HD for hours.
I'm going to add a little bit to that, and this is not related to disease progression, but just related to the effect of anesthesia and some other kinds of medications. Anybody who has something going on with their brain or central nervous system is going to be more susceptible to having disorientation, delirium, after they've been under anesthesia or after they've had some kinds of medications like opioid pain medications, some kinds of sedatives, even some kinds of antihistamines for allergies. And so it's something to watch out for. It's a transient effect, so it's going to get better over time. But if somebody does undergo a surgical procedure and afterwards they're confused, they don't know where they are, they might be seeing things that aren't there or hearing things that aren't there, don't worry. It's something that will go away. And it's important also just to limit the kinds of medication that can cause this. So things, again, like opioid pain medication, some sedatives, and to use the least amount of anesthesia that needs to be done, which the anesthesiologist will do naturally.
Great, thank you. Our next question. A family member refuses to take any medications for HD symptoms. What if a crisis happens that requires medication to resolve or treat? This is so common, and I went through that with my mom. It's such a difficult situation. It really is.
And sometimes we say to people, when people are refusing treatment, again, sometimes they'll say, there's nothing wrong with me, this is part of this anesthesia that we were talking about. Sometimes you do need to get things to a crisis in order to get help. So that's pretty common for families, I think, in this community, that if there is somebody who is refusing this and they have a fall, what I say to families is don't just pick them up, call 911. If you have this opportunity, this window to say there's something that maybe I could just put a bandage on it, don't. Have them go to the emergency room. That way somebody can evaluate them and you can talk to someone and say, this is HDs in our family. They haven't gotten tested, but we think that this is going on. So that might be the gateway of getting somebody in. So I think that it is going to be think ahead and don't just pick the person up and dust them off. Think about, could this be the way? And if they send them home, okay, then there's a paper trail. And then the next time something happens, because it probably will be the next time, then you can say, this is the second time this person's fell or something has happened. So now we need to get treatment. So I think that might be one of the ways that unfortunately we have to wait until that crisis to get help sometimes.
Also really depends what the symptoms are that the person doesn't want to take medication for and what the emergency is. And so it can be helpful. This is another time when sort of advanced planning can be really helpful. Set outside the context of any emergency or any request for medication or anything, have a conversation. If something happens where your life is in danger, you know, what do you want? Do you want us to do everything? What sort of things do you want done for you? Have that kind of discussion. And so when there is a very serious problem, when there is an emergency, then you know, even if somebody is, say, refusing medication at that time, you can say to yourself, we had this conversation. I know that actually what they want is the treatment for what's going on here. And then you can consent for that in that case.
Thank you. So just to add to that, my mom had a lot of psychiatric complications, and she never admitted that she had Huntington's, and that was caused a lot of issues. And with what Dr. Bonnie said, that is what got us the help. I used to call, you know, the police and the ambulance, and even, you know, adult protective services on myself, like, oh, she won't shower, she needs to be clean. And what ended up happening was a big public outburst that forced us into the situation of her going to the ER, which taught her some medicine. Really helped her out and helped the end of her life become a lot more peaceful. So I do appreciate that. I think that's the best advice in the situations that we all find ourselves in. So thank you. Okay, next question. Why do some neurologists take regular MRIs of people with HD and some never do?
Representing all the neurologists.
In an HD clinic, or with an HD specialist, I think the majority of neurologists who know about HD do not routinely order MRIs. I very rarely order an MRI because the changes that you first see with Huntington's disease may be small changes in the caudate entertainment, and it's within the range of a regular radiological exam, it will look normal. There are some scans we do now where we do this microcomputing, but the only reason, one reason I would think to get an MRI is if a patient presents with atypical symptoms, no family history of HD, and you don't know what's going on. You want to rule out things like normal pressure hydrocephalus. So as an initial order, you know, meningioma, which could be a very slow growing, you know, benign-ish lesion that might not affect the symptom. But as a routine for following the disease, the MRI does not really help us in terms of treatment, because with the MRI, we're going to be treating symptoms, not MRI findings. So if there's concern that the neurologist is insisting on it, then I can't imagine it's happening. You know, once a year, that's not something you consider routinely necessary. But I wouldn't quite blame all the neurologists too, because I have to admit that even in most training programs, most neurologists have not seen more than one or two individuals with HD. I will confess, when I took over the HD center, there was no one else willing to do it at our facilities. Was leaving. I had only seen 2 patients with HD in my training, and then I had a crash course by the doctor who was leaving, and had some additional on-site help. So it's not a disease most people are familiar with.
Well, thank you for taking that position.
I would just say do your own MRI for your progress report. You know, I know you're individual, just for yourself, progress report, know what's going on.
So if the MRI, the changes in the MRI, would you want to do them every year?
I mean, it wouldn't hurt. I mean,
So, it's an exposure to a form of, you know, activity with the MRI scanner. But most radiologists are not going to be able to detect a difference over the course of several years. So the MRIs are not really a routine MRI that you pay for is not likely to show a difference from year to year.
so like
Maybe
every
not-
other year kind of thing.
Maybe not even over 10 years.
Oh, okay.
jump in. As for me, when people come in, it's about thinking, what is clinically significant, right? So even when people come in and say, oh, I'm having trouble swallowing, and someone says, well, we're going to get you off to a speech pathologist for swallowing study. But I know, and as a people here do, what the outcome is going to be. This person has trouble swallowing, let's try to teach them chin tucks or for pureed diet. So I think it's a question in terms of what test, what diagnosis is going to be clinically significant. But if you have an assessment, is this going to change the outcome, right, as Dr. Costa said? So is this, if there's no change, or if there is a change, is there going to be something different in treatment? That's why I do think in our clinic that we have in where I'm in Roanoke, Virginia, I have patients, which I think happens up here with the panelists too, who do come in every 6 months. Because we can see some changes over time when we do this unified Huntington's disease rating scale and we see the changes. And will that impact our decisions in terms of how to treat somebody? So we're doing things and assessments that will give us feedback, and then we can take that feedback and do something with it. So if we can't do something with an MRI every year, every 2 years, every 5 years, then is that clinically significant?
The only thing I would add to this is that if somebody with HD comes in and they're having symptoms that are not typical for HD, say we're worried that they're having a stroke or that there's something else going on, then we would do an MRI. That would be important to follow HD. It's not helpful.
Well, I was actually just gonna add, I've noticed a lot of times, when people have something going on that you can't see or you can't take a picture of, it's a lot harder to understand. So a lot of people are wanting X-rays, MRIs, stuff like that, so there's a picture of what's going on. And, with Huntington's, I've noticed that there's not really a whole lot of that in the diagnosis. It's more functionality and fine motor. We've also noticed with her adjustments of meds, like the doctor had increased very slightly the baclofen that she was taking, and it started causing falls. Just minor increases can cause major differences, and there's nothing that can show you a picture of that without actually paying attention to the symptoms.
I would say the majority of patients in my clinic I follow over 2 million patients have never had an MRI unless they're talking to someone.
I kind of pay attention to detail, like with her, I've been with her for 5 months, so I keep paying attention and kind of in my head what I should do, what I shouldn't do, how it's getting, how it's not, what should I do. But sincerely, I'd probably call 911. Well, she had her first incident, I called my neighbor, which was a nurse, called her, and I called 911. So I just want to know everything.
And when it comes down to it, your observations are going to be much more useful than an MRI. You're better than a test.
Well, because I had to do, but my grandpa had cancer, my grandma had cancer, my mom had cancer. So I kind of followed all them sides, so if anybody was to have cancer again, I'd know early. So I'd like to know early with what's going on with her, so I know what to do, not be in a panic at the time.
I think the biggest thing with that is to get involved with the community. A lot of those groups and stuff that they have on Facebook.
Oh, yeah.
All of us that have been experiencing it, we're all more than happy to talk to you, help you, receive help from you. We're all one family.
Right.
We're all together.
Scared.